Live from our studios in London, South Africa and all across the continent, I am Thabo Mdluli. Good evening. Welcome to News at Pram. Our top story today, following the first case of COVID-19 in South Africa, a 38-year-old man from Hilton in KwaZulu-Natal Midlands, whose identity is known to Newsroom Africa, is reportedly still recovering from symptoms of the coronavirus. Minister of Health, Dr. Zweli Mkhize, has assured residents of the town that his department is capable of dealing with the case. He addressed parents of pupils at the House Preparatory School in Hilton, where the patient's children attend. Karinda Jagmohan has been following this case and joins me now live from Durban. Karinda, what is the latest update on the patient? Where is he based and who else has been isolated?
Good afternoon to you. Well, the latest update on the patient we've heard from the Minister of Health is that he is at Gray's Hospital. Now, the Minister of Health just confirmed and cleared with the media that this 38-year-old man had traveled from Italy via Dubai straight to Durban. He was with 10 other people, and we understand that they have also been tested, including 18 others who have been in direct contact with this man. And the Minister of Health, Dr. Zweli Mkhize, says that the department is following scientific protocols according to the World Health Organization by seeing who exactly this patient was in direct contact with during his time here before his diagnosis. They have contacted those individuals. They have been tested and are quarantined, of course, until those tests come back, those test results come back. We do understand that the man's wife and 2 children have tested negative for COVID-19. The children were at school for 2 days before the man was confirmed with this diagnosis. However, the Department of Health says that they do not urge the school to close down. They'll not be testing the children as well, because according to their scientific protocols, according to the World Health Organization, they needed to find those direct people the man himself had come into contact with and who have been tested. And he wanted to urge the residents of Hilton to remain calm during the situation. We understand that in a private meeting with parents of school pupils from across Hilton as residents of Hilton, he basically explained how further engagements with the department will take place and how residents can contact the department if they do feel like they do need to be tested in this regard.
Right, Karinda, talk to us then about the department's view on our capability as a country to handle the virus. What are the parents hearing from the minister today?
Indeed. Well, the parents as well as media heard today that since the outbreak began, over 300 South Africans have been tested here as they were coming into the country. But of course, we've only had 1 confirmed case of COVID-19 that the department is dealing with. Screening, the minister says, is taking place at our airports in accordance with the international standards that have been set by the World Health Organization. The department is also depending, of course, on citizens themselves who are coming from areas or countries where there have been outbreaks and cases to disclose this as the point of entry, so the department can then test you, isolate you immediately to see, of course, if you are infected with COVID-19. Further than that, there are hotlines in place, and the department says that yes, indeed, the NICD hotlines have been swamped. They are working on this to have more people behind those lines to answer questions that South Africans have. Of course, it's a very concerning moment indeed, and residents, especially in the Hilton, Pietermaritzburg and KZN area, are worried. My colleague Sipa Kema, who visited the Hilton area this morning, saw that hand sanitizers and other hygienic products were almost sold out, especially in the Hilton area. Just going forward as well, we do understand that there's certain criteria that one must meet in order to be tested for COVID-19. This includes that you must have traveled to one of the infected countries. You must also have been in contact with infected persons and been experiencing certain symptoms. We asked the NICD specifically why this was the case, and they explained that, of course, as this outbreak begins, we must ensure to remain calm and ensure that we don't, of course, overuse the department's limited resources that they do have, of course, because this is an emergency. We're picking out of those emergency funds, and toolkits must be preserved for our serious cases.
Why?
But of course, I also want to tell you that the department has said that they are wanting residents to remain calm. In fact, this is what the minister had to say, calling for Team South Africa, he says, to work together.
Karinda, what are they saying about the distribution of those test kits?
Well, the test kits are not being distributed directly to residents. If one does feel that they have symptoms, or if they meet this criteria, they've traveled to certain areas, they've been in close contact with infected persons, they need to approach, of course, the specified local hospitals. That's your Gray's Hospital, Addington's, Ngwelezane or Manguzi. Now, this is for KZN, of course. There are other designated hospitals across the country. And then, of course, as you approach your points of entry coming into South Africa, it is important to notify authorities there that you've been to certain places, you've been to certain countries, you need to be screened in order for you to ensure that it is safe for you to enter the country.
All right. And of course, there is more that was said by the Minister, Karinda, in a bite that you've sent for us. Just tell us a little bit more what he is saying there.
Well, what the minister really focused on throughout the media briefing, and we understand with his meeting with parents, is to avoid stigmatizing COVID-19, as well as to avoid spreading fake news. He says this is what will undermine the efforts of the Department of Health as they deal with this one case. They contain the virus here in that Hilton area. And of course, just to ensure moving forward, he says the country must work together to overcome the one case that we have in South Africa and to ensure the safety and well-being of the rest of our residents. This is what he had to say.
No country can ever stop coronavirus from reaching its shores. And it is not a failure of our health system. Some of the people have said to us, well, your health system is full of challenges. And we say, yes. It's overcrowded, yes. There are long queues, yes. Yes, all of those issues we are attending to. But we're dealing with an emergency here. To deal with that emergency, we don't have to quibble about the weaknesses of our system. We've got our strength. That is more important than our weaknesses. That's going to help to make sure that we can contain this virus. We can do it as South Africans working together.
Karinda, finally, before I let you go, of course, there have been conflicting reports around the 184 South Africans who are still in Wuhan, a city in China at this particular point. Whether or not the South African National Defence Force has got pilots to fly the planes to go and fetch them or not. Has there been clarity on exactly what's going to happen there?
Well, we did ask the minister this, and he squashed those rumors. He says, indeed, those 184 South African citizens are coming back home. They will be quarantined for several days, of course, as the department just screens them, ensures they are healthy to be, of course, back in the South African society here. And as he said that, he again reminded the country about not stigmatizing COVID-19, but indeed they will return home. I also just want to quickly give you an overview. Internationally, we have seen the cases of coronavirus surpass the 100,000 mark, but it is important to notice that while there have been over 3,000 deaths, there are many more cases of recovery. This is what the minister reminded the country as well in that media briefing, saying that over 80% of people who are infected with COVID-19 do go on to, of course, recover. It is very important to remember this as we see this crisis break out across the world. We see one case here at home. He says, be sure not to spread fake news and be sure to be researched in your information. And, of course, maintain proper hygiene as opposed to causing panic, he says, and spreading fake news.
All right, thank you so much. I appreciate it. Karinda Jagmohan reporting for us. They're live in KZN. That's where the first case of the coronavirus has been picked up in the country. Again, the emphasis is not to panic, folks. There is a huge number of those who are recovering from this virus. Let's stay